So basically, it is very good to us that we completed the 8 remedies in detail. Okay. Now we will talk. We have other topics like how to make the protocol. Okay, this is very important. Next, dilutions. Next, we have doses. And before everything is diagnosis. How to diagnose? Okay, next we have another one topic, that is pulse diagnosis. Okay, so these 5 topics are left. So basically, we will start with, and before dilution, we have to know the nature of disease. It is very important. So basically, first we will talk about nature of disease. Okay, then protocol, then dilution, then doses, then diagnosis. Why last diagnosis? I will tell you later. Okay, because if this picture is clear, then you can easily make diagnosis. If I first explained about diagnosis, how to do diagnose, then this topics before teaching these topics, if I teach diagnosis, if you have many questions. So for that questions, so first I will teach this, then you will have diagnosis topic, then you will easily understood. Then if any doubt, we will clear later. Okay. So these are the things. First, we'll talk about nature of diseases. What is meant by nature of diseases? Means the disease, whatever disease in the body occurs, how much is activeness, how much the disease can harm your body, how much it will affect the body. Okay, that is nature of disease. Okay, how much the disease affect the body in every stage of the body. Okay, every stage of the disease. Okay, so if the disease start in 0 to 20 days, how much the body affected? After 20 to 45 days, okay, after 45 to more than, or 60 days, 50 to 60 days, after 60 days, how much body will be affected? Okay, okay, after entering of the disease, how much body will affect on the particular days. So this define nature of disease. Okay, this define nature of disease. So actually nature of disease have 3 stages. We have 3 stages. How much? 3 stages are there to identify the nature. One is acute stage. Another one is subacute stage. And chronic stage. So in acute stage, we will define is from 0 to 15 or 20 days. Okay. This is the stage where your body will affected when the beginning of the disease to 20 days. So how much your body will be affected? So like one thing, that is, if a person have fever, after fever, if we can control that, how much body will affect? It will cause respiratory distress, heart rate increases, tachycardia, tachypnea, okay, headache, sweating, dry mouth, all these things seen in 0 to 20, 15 days, some in some cases more than 20 days. So what the nature when the disease enter to the 15 to 20 days, what is the nature? The nature of the disease is in positive approach. the disease will approach to you is positively, excessively. Okay. Oh, ठरविलं आहे. So the nature of disease, okay, what in acute stage is positive approach. So all things are will raise, okay, like fever, like respiratory distress, like headache, like sweating, everything will be excess. So excess mode when in acute stage, everything is excess. So that's the reason the name given by the Dr. Count Cesar Matti is positive. So what we will call positive disease. What we will call positive disease because in this condition everything is excess. Okay, why this excessivity happened? Because of the vitation. We have the vitation of blood and lymph. Blood and lymph. So vitation of blood and lymph cause positive disease, okay, which is positive in nature. We'll call acute disease. So in this, everything will access. Okay. So what we have to do, we have to balance this blood and lymph. Okay. So we have to remember acute disease or positive disease. Now we have subacute. 15 to 60 or 20 to 60 days. In this period, the disease may cause, if the duration is long, the disease may cause degeneration, beginning of degeneration. Okay, the body steadily, slowly will get into the degenerative stage, not completely degenerative. It is the beginning or mild to moderate stage of degeneration. Because in the long standing from 15 to 20, the body will have the disease. So the disease will enter into the body. The disease is attacked to the body. Like one example, I will give this fever only. After 15 to 20 days, what happened? The body will get, if the slowly the disease decrease, so body have weakness, letharginess, okay, unable loss of appetite. So why this happened? Because it entered into the degenerative stage due to the long standing of disease in the body. So okay, it will if it continues after 15 days to 60 days, what happened again? More than mild to moderate, the body begins to degenerate, to decrease its function. So what happened? But it will have slowly, steadily, very mild effect will have seen to the body. So it will grow very like tortoise or tortoise. Okay, like tortoise, it will like the body is gradually the degenerative stage. So it is acute stage. I think this gradually goes ups, degenerative stage, mild to moderate. Mild to moderate, 15 to 0 to 15, 15 to 60. Okay, mild to moderate. So what we call, what Dr. Pound Caesar Mathai given the name, that is neutral disease. What we will call neutral disease. It may be any disease, like we have any like gastritis. So it happens suddenly. Suddenly, in acute stage, what will happen? You have blenching stomach, flatulence, gases, epigastric pain, unable to sleep, unable to sit, unable to walk, you have severe pain in abdomen. It is the initial stage, and you took the medicine. The effect of the disease is calmed down now. Now again, you have after whenever you are eating, you have burning sensation in stomach. Gradually, the layers of the stomach, whatever study mucous membrane, what will happen? It will go slowly, steadily into the subacute level, degenerative level. Okay, so there's the reason Dr. Count Caesar-Matei give a name neutral disease. Neutral disease. Next, we have chronic stage or chronic disease. So in that, what happened? The regeneration happens. It will enter rapidly, rapidly. The energy of the body decreases. They have but the degenerative is not affecting the body, whole body. It is affected the any part of the body. Like we have knee pains. Gradually, it will enter into the degenerative stages. What happened? Osteoarthritis happened. Likewise, neck pain, back pain, gradually, 0 to 15 days, your severe neck pain. You took the medicines, gradually decrease. But sometimes you will have pain, sometimes you doesn't have pain. So what happens is the subacute. Suddenly what happened? The pain from the neck is coming to the arms, unable to lift the arms. Weakness in the limbs. So it is at more severe degenerative stage and it enter into a chronic stage. Okay. So that's the reason here chronic stage is defined as negative disease or chronic disease or negative disease. Okay. Negative disease because degenerative stage happen very rapidly. Okay, very rapidly. So everything is decreased, calcium deposition is decreased, disc problem occurs, nerve damage happen, unable to lift the hands. So this is the more degenerative stage. Rapidly the degeneration is started. Now what type of medicine, what we call is negative disease. So kindly note that acute disease, also known as positive disease, subacute disease, also known as neutral disease. Chronic disease is also known as negative disease. Positive, neutral, and negative diseases. So we have three type of diseases. So we need three types of medicines, three types of dilutions. Okay. So based upon nature of the disease, so we will select the dilutions. We will select the dilutions. So let's talk about something about dilution, not incomplete, but here I will. Okay, we'll start. We'll study about dilutions also. What meant by dilution? Dilutions mean the strength of the remedy equal to the quantum energy of the body or quantum level of the body. The strength of remedy is equal to the quantum energy level of the body. So both are equal. Then only the dilution, the medicine, the remedy will work. Okay. So the quantum level of energy, the quantum energy level of the body is in a subacute, acute is positive. In subacute, it is neutral. Okay. In chronic, it is negative. So your body is in positive charge, your body in neutral charge, your body is in negative charge. It is the quantum energy level of the body. So what we give the strength of the remedy is opposite to the quantum level of the body. So here in acute, already this your body is in the quantum level of the body is in positive nature. So what you will give negative nature dilution will give then only the body works, because law of similars here, law of polarity, okay, works here. Here, subacute level. Here, positive level. So you need positive dilution to match the quantum energy level of the body. Here is the positive, so you want to give negative quantum. Here, positive level, quantum energy level of the body needs negative energy from the dilutions. So, okay. So here we'll balance the body like that. So positive needs negative dilution, means neutral needs neutral dilution, negative needs positive dilution. So in acute, we'll start with negative, subacute, neutral, chronic, positive. What is the negative dilution? So basically, we have D1, spigeric essence, whatever we made D1. After D1, D2. Okay, D3. D3 will get into the company from the company. So after that, whatever first dilution you are making, you are taking the D3. This is the first dilution, D4. What we call first dilution, because we are breaking if you see the company is breaking till D3, after we got D4. If we are breaking, we're making this D1. So D4 is positive in nature, because chronic negative quantum energy level. So what we have to give, we have to give positive nature remedy. Which dilution have positive nature remedy? D4. And D5, after D4, we are making D5, because we are breaking it second time. So that's the reason we are calling dilution number 2. Okay, dilution number 2. So what this D5 have neutral energy level. D5 dilution have neutral energy level in the remedy. So that's the reason we will call neutral dilution, D5. And we have D6. After D5, we are breaking this into third time. That's the reason we will call third dilution, D6, or third dilution. So D6 have negative energy level in that remedy. So that's the reason we will call negative dilution. What we will call negative dilution. This is a positive, neutral, and negative dilution. So negative nature dilution, not negative dilution, nature dilution. So that's the reason in acute we need D4, D6, because acute is positive nature, or D6 is negative nature. And we have neutral need D5, because it is neutral. There's the reason we selected neutral nature dilution. Next we have chronic. Chronic need D4, because chronic is negative nature disease. So we need positive nature dilution. Okay, understood here. So this is the basic concept of dilutions and stages of diseases, or nature of diseases. Basically, what happened, what other teachers, other than that, is this it is correct or wrong? This is the first question everyone want to know. So basically that it is depend upon the disease you selected. What is the stage you are giving to the disease? Okay. Okay, that is the important thing. That's the reason they are dividing the dilutions and taking to the large number of extent, and including homeopath into the electro-homeopathy. Now members are giving D15, D20, D30, D50, D100, D200, D1000, D1 lakh. So these are the potencies which are used by homeopaths, not electro-homeopaths. Electro-homeopathy remedy is made till basics. Other than that, we doesn't require it because there is the no other type of disease, na? There is no other nature of the disease. So why are we are giving higher dilutions? So here we have only three dilutions: positive, neutral, and negative. So I think you understood about the dilutions and nature of disease. So this is get into a practice and you will able to understood easily. So every pathy have some their own beliefs to have to follow strictly and attach to them. If you are taking from other pathy, so you are not making your pathy as a healer to the person who want to take healing from you. So you're using other pathy. So that's the reason we doesn't want to use other pathy, homeopathy potencies, and we need distilled water. Not we were made our remedy will make in RS base. Okay, we use pure distilled water. You will get the result definitely because here we are understanding with scientifically we are approaching to the disease. So why we should not treat the disease? We will definitely treat the disease when we will calm the positive disease with negative dilution. Gradually, the positiveness will gradually decrease. Okay, so I hope you understand this lecture and please follow True Mati, which will benefit you and benefit the man. Any doubts? Fine.